Welcome to the Grange Clinic Edit, our podcast all about plastic surgery here at the Grange Clinic in Chester. I'm Anoni Harper-Machin, consultant plastic surgeon.
And I'm Paneet Gill, consultant plastic surgeon as well.
And today's podcast is going to be all about non-surgical rejuvenation, facial volumisation, what you can do with injectable products to improve your overall skin, your facial aging, that type of thing. So I wanted to ask you, because full disclosure, Ms. Gill does my toxin. And I can't look angry at anybody anymore.
She's never angry.
So tell me, how do you deploy toxin to sort of anti-age, make people feel better about themselves, that type of thing?
So I guess the first thing to say is that botulinum toxin, also known as anti-wrinkle injections, are used so often that actually everyone's a bit blasé about them. So we've got to be quite careful when we use them, where we put them in. I think because they're so freely available, and to be fair, they're not regulated.
No.
So the person that's injecting the anti-wrinkle injection into your forehead, let's say, may not be a surgeon, may not be a doctor, may not be aesthetically trained. They can often do like a 1-day course and start injecting. So what I would say is, just make sure, whoever is doing the injections, that they're fully trained and that they've taken all the precautions.
And they should be now, with the guidance from the Nursing and Midwifery Council, General Medical Council, they should be medically trained. And I know that the NMC, the Nursing Council, has said that nobody should be prescribing botulinum toxin without first having seen the patient face to face. For doctors, that would be going along with prescribing sort of regimens anyway. I spoke to a BBC journalist yesterday, actually, with regards to a trend for self-injection of Botox, and definitely
that's I mean, you see that quite a lot on Instagram. A lot of people posting about injecting themselves, and I think we were discussing this earlier. It's not just the anti-wrinkle injections. Even I've seen people injecting filler into their own face, which I think is just
frightening.
It's just crazy, really, isn't it?
So I would definitely advocate that you seek out a practitioner that is medically trained. And for example, at the clinic we have 2 nurses that are trained in plastic surgery, and then ourselves and other consultant colleagues who would inject. So what different types of toxin are there? Are there any different types? What can you do with it, basically?
So I think there's quite a number of different toxins available on the market. So there's the traditional ones, which have been the type A, which is what's most commonly used. And they were initially used by ophthalmic doctors, actually. So it was used for, was it strabismus? Was it for lazy eye?
Yep.
But at the time they just found out, actually the wrinkles are looking a bit better, and that's how it all started, really, back in the day. So in terms of what we commonly use, there's a few different toxins. I know there's a newer one that we have been using more recently.
A liquid form of toxin
which kicks in a bit quicker, lasts a bit longer, according to what they are telling us. And I think from first-hand experience, we've been having good results with it so far. But in terms of the traditional toxin tends to, take a few, 4 to 7 days at the earliest to kick in. And then it can last, I always say to patients, anywhere between 2 to 4 months. And actually, I get patients who leave it a little bit longer, so you have a bit more of a natural look rather than the fully frozen look. So, but with those ones, you do tend to have to keep coming back for top-ups because it does wear off. Whereas the newer one that we have been using does last a bit longer. So you don't need to have as many top-ups. But I guess the point is that it is temporary. So what it does, it acts on the muscles in the face. So the most common areas that we tend to treat are the forehead, the glabellas, the 11s lines, the angry lines that you can get at the, in between your eyebrows, and the smile lines, which are also known as the crow's feet. So they're the 3 main areas that are most commonly treated. And what the toxin does is it basically temporarily reduces the function of the muscle. So the dynamic lines that you get, so the lines that come up when you make the movements, are reduced because the muscle is basically not fully paralyzed, but it's turned down a bit, so it still moves, but it's not as active.
Yeah. and you can tailor the toxin injection to do the things that your patient wants to do. If they want to target a particular area, if they want slightly up dose to have less movement, or as you say, a more kind of natural look where there's still a reasonable amount of movement. You just tailor the dose of the toxin and the dilution of the toxin to suit what you're wanting to achieve. And also you can symmetrize faces. So if people have a slight asymmetry between how their muscles move, you can adjust that using the toxin. And also, I think, and this is speaking personally as well as what I've seen from patients, it just improves the overall kind of skin look. It reduces the sizes of pores.
Yeah, they look a lot more smoother, not just actively sort of less wrinkled.
Yeah.
And then also, I get a lot of patients say that their headaches have improved.
Yeah.
So it's used a lot for migraines and so there's
Sinusitis
other
pain,
effects as well. Yeah, for sure.
And also there have been a couple of papers published recently to say that it reduces depression scores.
Right, okay.
So if you can't make, and this is the liquid toxin work, if you can't make negative facial expressions, your depression score decreases.
Okay.
So you feel happier
because you can't look angry or sad in the mirror. So I guess, yeah.
So
and that's been shown in studies. So it's actually objectively
in their
shown.
randomized control trial, which is why they've said, no, you can state it as a medical treatment as well as purely cosmetic, basically. So that was super interesting. And yes, we use the toxins I use in the NHS as well for facial paralysis. And tightness and migraines in the face, tightness in the neck, and also sweating.
Yes, so also known as hyperhidrosis, but basically the posh name for, when you have excessive sweating either from the armpits, I've used it in feet and hands before. So these are patients who, it's a bit more than just being a bit sweaty. It's where they're actively sweating a large amount and, it's not being sorted with antiperspirants or the stronger talcum powders, that kind of stuff. And 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 it affects their daily living activities and potentially their work. So
and as well, people going to the gym, people want to wear certain clothing. And if you have big sweaty patches down your legs, then it's not. People don't want to be at the gym and have that happen. So there is
you obviously expect to be sweaty at the gym, but otherwise you're not.
But
really
this
is,
out as you say, it's excessive and it stains clothing. And people don't. There is something that you can do about that sort of level of sweating,
and that's before any surgical interventions, which can be very extreme. So it's a good way of doing that.
Just limiting that, and that just works on the little sweat glands. In the same way as it paralyzes muscles, it can paralyze the activity of the sweat glands, and so you don't just produce really any sweat, and that is just multiple little injections underneath the skin. I have to say, it stings a bit.
It does, depending on where you inject it. So I guess in the armpits, actually, because the skin's a bit looser and it's not as sensate as, say, your palms or your feet. So, you can get away with doing a bit more there. But, it's one of those things, no pain, no gain as well.
Exactly. And similarly for, facial injections and that thing, it is multiple little injections in the face. It's over in a few seconds, but it does sting kind of while it's happening. But it's it's an acceptable.
It's bearable. Most patients say, and everyone comes back for more. So I guess that's always a good indicator that it's doable. And I guess going back to the face from our point of view in terms of aesthetic use of it. So we often use it for, you can do a chemical brow lift as well. So depending on where you place the anti-wrinkle injections, you can modify the function of the muscle. So you can still get a little bit more of a lift at the lateral edge. And actually, so there's loads of ways of refining the technique. And this is why it's so important not just to go to someone who's just following it almost like a cookie cutter approach where they put the same amount in the same area, because every patient is different and the expectations are different. And what you're trying to achieve is often, you can modify it. So I think that's fairly important.
And I love to inject different areas of the face.
Yeah. So apart from the usual three, which other stuff
so
can we discuss?
really smooth out, a turkey neck, so the platysma bands, you can inject in there. And also if you inject along the jawline, you can get a little bit of lift.
That's the Nefertiti lift, isn't it? That's also known as the Nefertiti lift.
And sometimes for gummy smile, you can just lower the lip or soften that off a little bit. People don't like the dimpling around their chin, so it can be injected into the mentalis muscle at the chin, and that sorts that out.
You can do, is it called a lip flip as well, isn't it? Yeah. So I don't really do lip flips. I'm more of I think go more down the line of filler in terms of giving more volume, but in the correct patient actually who doesn't need much volume, that's where the botulinum
if you inject just at the upper part, you can, because of the strength then of the muscle just by the lip, it kind of rolls it up and outwards.
I've also used it. DOAs.
So the depressor muscles at the side of your mouth, if you inject those and weaken those off, differentially the mouth lifts up at the sides. So sad mouth is a good one.
Yeah. And then the other one I've injected as well is the masseter muscle. So when you clench your mouth, you get quite a lot of bulk there. Yeah. Often patients who want to slim their face a little bit because of the bulkiness of that muscle, you can inject it into the masseter and that will slim it down. You have to be a little bit careful though, because actually when you do the injections, sometimes it can make any jowling that's present worse. So the patient selection is very important in that group.
I tend to just do young people actually.
Yeah.
So that don't really have jowls. So yeah. Now, it's not without its complications. People think it's a very straightforward thing to do. It is a very straightforward thing to have, but it does have side effects or complications, albeit that relatively low profile. But
it's that dreaded droop, isn't it? The ptosis of the upper lids.
Yeah. So where your muscle, the toxin has migrated slightly into the upper eyelid area, and it closes the eye down or on one or both sides. And obviously, if that happens to you, it's a bit rubbish. But knowing that is not a permanent entity on your face, it does wear off, and there are eye drops.
Eye drops, as I say, they can temporarily
can temporarily help you open your eye a little bit more.
And that's all because usually the placement is either a bit too deep, or mostly it's migrated, so it's moved away from where it's been injected. So there's certain things that we tell patients not to do after the injection.
Yep. So no massage, no rubbing in your face cream very firmly, no saunas, no hot tubs, or anything that's going to vasodilate your blood pressure up and vasodilate you can migrate your toxin.
And there's also, I guess you do this as well. When I inject, I do certain maneuvers where I'll do the injection, you block the spread, the direction of the needle.
Yeah.
And then once I've injected, I normally stand there for, a little bit longer just to get it to settle rather than whack, rather than doing it too quickly. So take your time so it's less painful, injecting it into the correct plane as well.
Yeah.
So all of that really helps.
Knowing your anatomy.
Yeah. Yes.
Sort of helps.
Yes.
And then you get little needle marks, tiny, they fade within an hour.
You get little blebs, little swellings, which settle down.
Yeah.
But yeah.
And then sometimes people don't like the result. I have to say, sometimes it makes me feel like a little bit like there's a little weight pressing on my head. And I've noticed that as a sensation since having toxin. Is it
because you're used to being able to move everything, and then you're fighting to try and get that moving?
Exactly.
It's not moving.
And it's funny, but that is something I've noticed. It feels like there's just like a little weight there.
It's just something to get used to, though.
Exactly.
You get used to that. Yeah.
So yeah, but toxin is an excellent one. And if you could do anything for refreshing the upper facial area, forehead, round the eyes, that would be what I would do for sure.
Yeah. And also, once you've had it done, often we tweak it a little bit. Sometimes you come back for a little bit of a top up if you need a little bit more.
Although I found that with the liquid toxin, that's just not necessary.
Yeah.
And I think that's the appeal of it, is that actually it is just completely cut a swathe through any top ups and stuff. It seems to be.
And I think placement's so important as well, where it's placed, because I think the other thing that people, patients sometimes get when they have injections, they get what we call the Spock brow, where there's still a bit of movement laterally and it looks, you can tell that they've had a toxin injected and it just looks a bit funny, and they have to have a little bit, a little bit higher up just to release it, soften it a bit. Yeah. And there's also the what we call the Wi-Fi lines. So you get these few lines just above the eyebrow. that can be often quite hard to treat. You can put a little bit of a superficial injection there, but it doesn't particularly last very long. So there's just a few things that you can tweak around just to get the best result. But overall, pretty good.
We love a bit of toxin.
Yeah, it's a good way of getting a bit of a refresh that's temporary. It doesn't break the bank too much, in terms of how, comparing it to surgery, let's say. And it's a nice way of dipping your toe into the cosmetics.
And also maintaining a look. So,
yes,
all my facelift patients tend to have toxin and stuff as well because they're maintaining a full facial look.
Yeah.
So I think
it's great stuff.
Important. Yeah.
So if we move from toxin to the volume fillers, so fillers in general. So injectables, yes. So the most common one that's used, I'd say it's probably hyaluronic acid. That tends to be the one that, is used for mid-face, for everywhere, lips.
Yeah, it just depends on what they call the rheology of the filler, which is a posh word for how thick is it. And the more sort of cross linkage or chemical bonds in that filler and that hyaluronic acid, it makes it denser. So you can have quite liquidy.
And why is that important?
Well, because it's a dynamic thing when you're injecting filler. So if I'm building up on bone, so if I want zygomatic projection, so cheekbone projection or jawline protection, chin, almost like an implant, like a chin implant, then I'll use a very high density filler. Because I'm putting it straight onto bone and I want it to almost act like an implant, a facial implant or that bony structure. If I'm volumizing or enhancing soft tissue, I will change up what I use. I will use slightly medium density for somewhere that isn't moving that much.
Yes.
So the base of the nose, into the sides of the sort of face. So for masculization, for if chaps want some filler and that type of thing, I'll use something medium density because it's not moving. For lips, nasolabial folds, and anywhere where you could potentially feel or palpate the filler, I'll use something really quite soft and quite squidgy. Because when you smile and you move your lips, you want your filler to move with you.
Yes.
And for it not to be obvious that you've had filler. And the modern products, hyaluronic acid products, are excellent. There are calcium hydroxyapatite products. There are various different things. I'm a hyaluronic acid girl.
Same here.
I just find the safety profile on
it's just more user-friendly, isn't it? And patients seem to tolerate it more in terms of, complications you can get with certain other ones where you can get, filler cysts, you can get a lot of inflammation and infections.
And if I want to dissolve it, I can dissolve it. So if I have, if the patient doesn't like it or I've misplaced it or there's a problem with it that doesn't resolve with a bit of massage, then I can just dissolve it.
So in terms of dissolving filler, so it's hyaluronidase that we mix up and inject it into the actual site where you want to dissolve the filler. And then we have to do a test patch first as well to make sure that you don't have an allergic reaction. Once it's injected and you're dissolving the filler, how long would you say you tell patients to allow it to do its thing before we consider, say, refilling or, doing a slight modification?
Well, it will dissolve it pretty much straight away. The enzyme works immediately, which is why it works for some of the complications for filler, which we'll get onto in a tick. But you do get quite a lot of inflammatory swelling.
Yes.
And so you can look pretty puffy where that's been injected for several days up to a week or so. And so for me, I would normally say I would if I was dissolving, I would dissolve. I would see them a few days to a week and just check that it was as it should be.
Just in case you need to top up the hyaluronidase as well. So sometimes you need to top it up a bit more.
Yeah. And then probably about 6 weeks I would leave it before I would go in again and just to let everything completely settle, because I treat filler a wee bit like an implant.
Yes.
And so I want no sort of inflammation or problems around that because I don't want it to get infected or have an issue. So I clean religiously, and I treat it as if it was like a mini sort of surgical kind of procedure, really.
And then I guess when you do refill the area, actually it's different to filling in an area that's never had filler.
Yeah.
Do you notice that as well? I mean, I've done it before where I've had to dissolve stuff and then refill, and actually the skin quality is a bit different. And because it's been stretched already, what you find is that it can get a little bit saggy as well. So, just leaving it as long as possible for everything to settle down and then re-injecting.
Well, and there's a trend for now people having filler dissolved and having a facelift. I know you had an experience where actually the lady had filler on board.
Yeah. So this whole thing about fillers only last around for 9 months and you have to get them topped up is absolutely, it's not true at all. From, there's been studies that have shown, MRI studies show that filler's still around, but actually just from our own experience when we go in for doing facelifts, like we said the other week when I was doing it, actually the filler pocket was very obviously there when I was raising up the flap of the skin to sort of get to the SMAS, which is the deeper muscle tissue where you do the tightening for facelift. But it was almost like the filler had just been injected. You could see the gel. It looked fresh, even though the patient said that, they had filler done 2 to 3 years beforehand. And, even she was surprised it was there, but it was just the fact that it hadn't even sort of partially disappeared or scarred down. It just looked like it'd been
literally.
So it just sits there, yeah. So, even though it's great stuff when used correctly, but we've got to be realistic about, not just constantly topping up too much, because then you get that pillow face appearance, which is what is giving filler such a bad name, I think.
Yeah, so like Madonna, for example, she has had a lot of filler. And it's not to critique that, but that is what happens whenever somebody wants that youthful volumized look and just keeps on going back for more and more and more filler. And for example, Lindsay Lohan, has had a facelift as has her mother, and they had their filler dissolved and then had facelifting surgery. And it is because they like the volume of youth, but then actually you get to a point where you're having to like physically restore the placement of the volume rather than just piling on filler on top of filler on top of filler. And anybody that tells you that it doesn't last it's just not true. And you should expect out of well-placed filler to get at least 2 years out of it, basically. And you can have other areas done, but it's.
I guess with filler, the whole point is you're trying to rebalance the face and trying to restore where volume should be, or for a youthful appearance. But the problem is when you keep going with it. You need to know when to stop, and actually. We're quite. I mean, I know I'm quite. I find it very easy to say no more filler.
You're done.
And you're done. You don't need any more.
Have something else.
Yeah, exactly. Yeah, you don't need filler. Just exactly. You look good.
Leave it at that.
But it's quite hard to actually say that to patients, isn't it? Because obviously they come with expectations,
it looks nice, and I really enjoy doing it. And again, in my facial palsy service, my facial paralysis, they often need volume symmetrization, because one side of the muscles is quite wasted in comparison to the other, and it works beautifully. And same for stabilizing a paralyzed lip and that type of thing. So it's an excellent, excellent thing to do for someone, both cosmetically and functionally. It does have, again, complications, side effects.
So this is the bit that scares everybody. Well, I know for definite,
sort of complications. I
know while we were training, before we became consultants, filler was the one thing that even now, to be fair, you do worry still, because you need to make sure you know the anatomy. Because if you do inject it into a vessel, inadvertently, or even around a vessel, and you end up sort of pressing it so it closes off, and that reduces the blood supply that's going through that to the skin, then you can cause what we call necrosis or tissue damage, which initially can be reversible, but can get to a point where if it's not managed sort of pretty immediately and urgently, then it is a permanent skin necrosis. So the skin dies off, basically.
And you may end up needing a reconstruction. Now, the anatomy of the face is very special in that it has several what we call end arteries, i.e. the artery ends in that piece of anatomy, for example, at the nose, at the lips, which is why it's so important when you are injecting filler to know that. And that's why necrosis happens, because if you injected it into inadvertently into a vessel in the hand, it probably wouldn't matter that much. The blood supply is very, very rich. But in the face, some of these small arteries that supply the lips, the nose, they can be blocked off by filler. And in very, very rare circumstances, and I've not seen this personally, but it can cause blindness and stroke.
Yes.
Should you get it into one of the vessels that then becomes an intracranial or into the head type
It tends
vessel.
To be around this sort of area here, isn't it? The kind of the fillers, people putting filler in the glabella
and the nose.
Yeah. So a lot of people do the non-surgical rhinoplasties where
they do.
And
you have to be careful, and you have to know what you're doing.
Yeah. Or some people use ultrasounds when they're doing the injections as well, to be super careful. So there's ways of doing it as safely as possible. But it is the more riskier side, I would say, of fillers in this sort of area,
And I just don't think that people appreciate necessarily the risk that they put themselves under. Filler for me, so whilst toxin is a prescription-only medication, filler can be bought by anybody online. And so you might have a practitioner, I say that in the loosest sense of the word, but somebody that hasn't even got any training, who sets themselves up. I think that would be, it has happened, and people are being injected by non-trained people that don't know what to do with the complication. So
and that's the difficult bit, really, is knowing what to do when things go wrong, because obviously we do everything with the best intentions, but anyone could get a complication. No one's immune to anything. Problems. It doesn't mean you're necessarily doing the wrong thing. It just sometimes happens, but it's what you do with it when it does happen. So I think my issue is when patients get injected by people who aren't particularly medically trained, and there is a complication and they don't deal with it, and they pass it on, and then that delay can cause a lot of issues. So even medical doctors, if you're injecting, you should know how to manage a complication. If it's a skin, you don't fob off the patient. You see them straight away. You assess them. You inject hyaluronidase if needed. If you're suspecting a blockage,
or you refer them to somebody that does know what they're doing.
or you get some help. So either way, I think it's pretty urgent treatment. You don't sit on it. You don't wait and see what happens till the next day. And I think as long as you kind of know how to deal with it and get help if you're not sure, then that's fair enough then, isn't it? Because you're doing everything in the best possible way.
And then I just wanted to touch on, when we're on facial volumization, fillers are probably your most standard way of volumizing the face and changing the shape of the face in a clinic setting. I do a reasonable amount of fat grafting into the face.
So how's fat grafting different to fillers?
So you are harvesting the patient's own fat, usually from their tummy area, processing it using a special little filter, and then re-injecting that fat as a graft. So in a similar way as like a skin graft will take up a blood supply if you put it on a wound, fat will take up a blood supply from its surrounding tissues. So you inject it into an area and you're expecting those fat cells to survive.
And how many of them do stay put?
Well, conservatively, you overfill by about 40%, because you're expecting between 20 and 40 to kind of reabsorb or be a bit of liquid that you have still got in that syringe, because it's removed. The fat is removed using a liposuction type technique. So that's basically fat grafting in a nutshell, which is kind of a hybrid surgical injectable sort of procedure. So it's still a surgical sort of intervention with the fat harvest and that type of thing, but it's an injectable product. So if somebody wants their own tissue, doesn't want something that's foreign to them.
And it's permanent, isn't it? In terms of it's your own tissue, it stays a lot longer.
Once it's taken.
Once it's in. Yeah. And if you lose weight, does it get less?
It does.
Okay.
Yeah, because your fat cells, when you put on weight, your fat cells store more fat.
Okay.
It's not that you have more fat cells.
Right. It's just they change.
They change size.
Okay.
So when you lose weight, yes, by virtue,
it
you will lose some volume, which is why when people lose weight, they see their face get, everything gets thinner. It's not that you're losing fat cells, it's that they're just not as big.
Not as plump.
So yes, that is, I suppose, the issue. So if you should be probably at a stable weight for fat grafting, that type of thing. So,
And I guess one last thing actually that I'd just like to mention just before we round everything up and finish up is tear trough filler.
Oh,
that's another thing that we get asked quite a lot about. I love doing tear trough filler in the right patient, but again, I see so much of it done pretty badly.
Yeah.
And it does scare patients a lot because, it can cause that kind of appearance where you've got a bit of a roll, where you can get a bit of a cyst.
Yeah.
It looks, it can sometimes make the puffiness under the eyes worse.
Yeah.
Usually the tear trough filler is there to fill the hollowing of the eye that makes you look a bit tired, We need a little bit of something there, a little bit more than just a bit of eye cream. But actually when I do tear trough filler, in, again, the right patient that wouldn't benefit from surgery, but would benefit from filler. So the younger patient that's got quite, mild laxity of the skin so that you can put in a nice little pocket. And, a very small amount goes a long way.
Yeah.
And you can build it up if you need to. So start small and go higher. But it works really well in the right patient. There's certain patients who, when you assess them, they need a blepharoplasty. That filler is not going to do anything apart from make it look worse. So I think, filler gets a really bad name, but actually it's such a good product when used in the right patient, in the right way, in the right amount as well.
Yeah.
So the tear trough filler I think is a good one, but in the right patient.
And tear trough fat grafting as well.
Oh yeah, and tear trough fat grafting for a bit more of a permanent result. Yeah. Fantastic.
Amazing.
So I think that's everything in terms of what we're going to talk about today.
Yes, there's so much to cover, so much.
So we can do some more stuff on a different podcast. But I think for today, I hope that's helped, relieve some of the myths and relay a little bit more reassurance that actually, botulinum toxin anti-wrinkle injections are very good.
Yeah.
And also fillers, are good when used correctly. But make sure that you go to someone who knows what they're doing.
Absolutely.
Okay. So until next time. Bye-bye.
We'll see you. Bye.